I'm Ashley Pavelka-Smith. I'm the palliative care nurse practitioner here at Mary Lanning Hospital. Palliative medicine is a specialty medicine that helps people with chronic illnesses, terminal disease, and a life-limiting disease. We help by increasing the patient's quality of life. We mitigate symptoms and suffering, and we also help with the disease burden. We want to decrease that. Palliative medicine there's a lot of misconception around it, and a lot of people think it's end of life care, and that is just because of lack of education. Palliative medicine, you can continue your curative treatments, aggressive interventions. You can continue to seek interventions if you are critically ill in the ICU. What palliative medicine is I fill 3 buckets, is what I tell my patients. The first bucket I fill is symptom management. I help with pain, nausea, vomiting, constipation, depression, as these patients are experiencing this because it's brought on by their disease. The second bucket that I help fill is medical decision making, and that's where the concept of goals of care comes in. Goals of care, I help get to know what makes the patients tick. I help the patients. I sit down and talk to them, provide a lot of disease education. They trust me during this process. I talk to them if they want that surgery, if they want that chemo, if they're able to tolerate that, and what those next steps are if they don't want any of that. And then the third bucket is coping. I help a lot of the patients and their family members cope with that terminal illness and how to navigate life with that. But then I also help support the family members and help them cope. And sometimes it's as simple as referring and getting resources from the community, whether it's home health services, helping with their symptoms, and then navigating, do they need a nutritional consult? Do they need in-home private caregivers? I take care of the patients as a whole. And I look at it as a holistic approach. I see my palliative care patients here at the hospital on the inpatient setting, and then I also go to the cancer center, both Hastings and GI locations. If you guys have any questions about palliative care services, or if you feel like your loved one needs a palliative care consult, please contact Mary Lanning Healthcare, and they will get you into my direction. Thanks.